should look at my watch. We're still good morning. Good morning. Want to start by saying thank you so much to Governor Cooper and Secretary Cohen for your visit today, but also just for what you are doing for Dare County and for North Carolinians. Your leadership throughout the pandemic has been extraordinary, and even more so with the vaccination efforts. We appreciate what you're doing today to help us spread the word about how important getting vaccinated is and how it can help us truly move to being on the other side of this pandemic. I also want to thank our extraordinary team in Dare County for their efforts over the past more than a year now, between managing the pandemic, keeping our services going without interruptions, and then now with our mass vaccination efforts. So we have an extraordinary community. We're happy to share that with you all a little bit today, and we just appreciate everybody's efforts and the team spirit that we have to accomplish the great work that we do. So from our elected officials to our business community to our healthcare providers in Dare County to our nonprofits and all of our citizens who are engaging in this fight and doing this extraordinary work, to hang in there. We're going to get it on the other side of this pandemic together. So let's get vaccinated, and we're going to get this. We're going to get through this together. Thank you.
Well, good afternoon, everyone, and thank you all for being here. And Governor and Dr. Cohen, this is incredible for you guys to come down here and see our operation. We're pretty proud of what our Health and Human Services Director, Sheila Davies, has done, and all of her staff. We were talking today, I was just talking with the governor, and he was proud of the fact that we're close to hitting about 70% of those in age 65 and over having vaccines throughout all of the state. And Dr. Davies leaned over to me and the governor said, what does it look like in Dare County? She said, well, we're 91%. So that's incredible. But our county has certainly been following your leadership, Governor, and we can't thank you enough for that. And we appreciate everything that the state has done. And we're just proud, as our Health and Human Services Director said, we're proud to show it off. And I believe by the end of the day, we'll be pushing somewhere in the neighborhood of 30,000 vaccines in Dare County. So once again, I encourage our public, those that haven't been vaccinated, to please register, get your vaccination, and be a part of this successful program that we've had here in Dare County. So once again, Governor, Dr. Cohen, thank you all again for being here. It's most appreciated.
Thank you, Mr. Chairman. Thank you, Sheila. Thank you to the EM. Thank you to the county commissioners who've shown up. I want to recognize Mary Jo Alcoke, who's the head of the governor's Eastern office and works closely with people here. And of course, Secretary Cohen, I'm going to recognize her to say a word or two. Then we'll take your questions. You know, vaccinating people is the way to turn the corner on this pandemic. And I'm proud of the work that's been done all across the state. We heard how well Dare County was doing, how people were stepping up to get their vaccine, how people were volunteering, how the whole health system came together to make sure that people got these life-saving vaccinations. I'm so proud of North Carolina when you think about how we lead the nation in medical research and making sure that we help provide therapeutics to people. And what we're doing now is making sure that we distribute vaccines in a way that's fast and fair. We want vaccines to go into people's arms. We want those arms to look like the people of North Carolina. We've done that well across the state. The chairman mentioned the numbers. We have more than a third of North Carolina adults fully vaccinated right now. About 46% of all of our adults have had at least one shot. Close to 70% of people across the state 65 and over are fully vaccinated, and close to 76% of people 65 and over have had at least one shot. And we know that 65 and over range is so important because we had more than 80% of our deaths occurred in that demographic age group. So this is why it's so important. We have to remember, though, we've still got a few more months to go of making sure that we continue to look after each other. Wearing the mask, being responsible is critically important. And I know that tourism and hospitality have been hit hard by this pandemic. But I know that you all are working very hard to come out of this in a safe way. This is one of the most beautiful places in the entire world. Whenever I meet a senator or congressman or talk with Governor DeWine in Ohio, I have to defend our honor. We are first in flight, and there's no doubt about it. You guys had the bicycle shop, we flew the plane, but I'm grateful for all of the hard work that's gone on out here in Dare County. We want to make sure we push through this, and I look forward to working with the General Assembly to put together a budget that makes sure that we invest wisely money from the American Rescue Plan, and look forward to coming together with that in the next few days. And let me recognize Dr. Mandy Cohen, who has helped lead our effort, not only in vaccinations, but in the health of North Carolinians. And I'll turn it over to you, and then we'll take some questions. Dr. Cohen.
Well, thank you, Governor. And I first want to thank Dr. Davies as well and the entire team and all the vaccinating providers. I want to make sure everyone knows that in Dare County, almost half of adults have received at least one vaccine, and that is the best and highest rate of any county in North Carolina. So Dare is leading the way, and we are really proud of that. So, and I was talking, and it is evident in our visit here that the reason Dare County can be as successful is because of the deep commitment to each other, the community that is here, and the partnerships. Now, you all are no stranger to responding to emergencies, and all of those partnerships and the hard work that's gone on to prepare has also set Dare County apart in being able to respond to this pandemic. So thank you, Dr. Davies. Thank you to Emergency Management, Drew, and others who've done a terrific job. I'll just remind everyone again, as folks have said, vaccines are our way out of this pandemic. They are safe, they are effective. Everyone over the age of 16 is eligible right now for their vaccine. So we're going to keep wearing these masks while everyone gets their spot to get their shot. Thanks so much.
We'll now take questions from the media.
We can start with our cool media, the Coastland Times.
Okay?
Governor, I think you indicated that in your budget you have some funding set aside for school nurses. Can you elaborate on that, please?
So we know that our schools are critical to the future of our state, to our children, and we know that children have gotten behind during this time. I'm so glad that we were able to work on a bipartisan effort to get students back into the classroom. That was important not only for learning, but it was important for health of the students. Many of our students get nutrition, they get socialization. Also, schools can be a canary in the coal mine. School nurses, teachers, others can spot problems that children may be having, and we've been missing that during remote learning. I believe that we need more counselors, more nurses in our schools, more teacher assistants to assist our educators to make our schools the best in the country. The governor of each state got some discretionary money called GEAR money from the CARES Act and also the American Rescue Plan. And we wanted to make sure that we helped to invest to bring more school nurses and counselors and psychologists into the school system to help with the mental health and the physical health of our children. And I met several school nurses out there today. I understand Dare County has 10 school nurses. That's a good investment to have. And I think I talked to 3 of them, but they're so happy to be here, so grateful to work in Dare County. It was just good to hear the positive vibes that we would get, and they were all glad to be back in the classroom, that's for sure.
So Dare County is leading the state and the counties of people getting vaccinated. What can other counties learn from this, and what do you see moving forward?
So I think logistics are important. Making it easy to make an appointment, making sure that people are there to volunteer, to make sure that getting a shot is fast and uncomplicated. I think Dare County's done a good job. One of the things that we did as a state is we put together a database that keeps up with all of the demographic information about our shots. And so we know where the problems are, we know how to target it. So we're going to keep working. I think it's going to be key because we're going to reach this point where the supply exceeds the demand. We're not there yet, but soon we will be there. And we're all going to have to work together to deal with vaccine hesitancy and to encourage, and I'll tell everybody in the room, encourage your loved ones, family, friends to get vaccinated. These vaccines are safe and very effective, and it's going to be important for us to engage faith leaders, community leaders, doctors and doctors' offices, trusted medical providers, in order to increase the number so that we can turn the corner on this pandemic. And we have a lot of efforts across the state in all demographics. We got Richard Petty doing an ad for getting people to get a vaccine. So we're going to keep working on that.
Dare County is especially going to be a destination for people from all over the country and all over the world coming to the Outer Banks over this summer and this busy season. What are your recommendations and what's your thought on handling that influx of people here?
Well, I think it's good that Dare County is getting their population vaccinated because this is a county that relies heavily on tourism for its economic growth and survival, and getting as many people here vaccinated as possible so the population can be protected. And making sure we still abide by common sense rules of making sure that people are clean or that places are clean, and that we're still obeying social distancing in restaurants and doing the things that we need to do until we can get enough people vaccinated. Hopefully by the summer, we're going to be in really good shape, we hope, with this pandemic, and we look forward to laying out some more foresight about where we think we can be. With Johnson & Johnson being delayed last week, then that threw a little different viewpoint on where we are with vaccines, but I'm so happy that it looks like our providers across the state haven't missed much of a beat. I mean, we had over 80,000 people, vaccinations administered the 2 days after the Johnson & Johnson pause. So providers switched over to Pfizer or Moderna and kept on going, which is a great thing.
What is your message to those who are still hesitating when we see 2,000 new cases? For those unsure, you want them to hear from you directly. What do you say to them?
Well, first, these variants that we're seeing across the country and here in North Carolina are more contagious than the original COVID-19 that we saw, and they can make people sicker. There's still a lot of virus here. We're having around 2,000 positive tests a day. People are still going into the hospital. We have more than 1,000 people hospitalized with COVID-19 right now. So it is a serious disease. Millions of people have taken these vaccines, and the percentage of effectiveness is extraordinary. You can be pretty much assured that it's going to protect you from getting it, but even if you do get it, these vaccines are going to prevent you from being seriously ill. And with the millions of people who have taken them, and you can see how safe and effective it is, that you really need to do it. And also you can appeal to people's sense of wanting to protect other people, not just themselves. That's what mask wearing is mostly about too. So we want people to get vaccinated, and we want people to be missionaries, to go out and talk to people that you know, talk to people that you love, make sure that they do it.
And we can take one more question.
Dr. Cohen, the new map coming out a short time ago shows Dare County in orange, and Sheila, if you want to add to the comments on this. But could you just comment on the new map coming out today? Edgecombe showing up in the red, but for the most part, the rest of the Northeast is in the yellow, except for Dare County, which is in the orange.
Yeah. No, thanks for that. And I think it speaks to what the governor was talking about, is that this virus is still here with us. And unfortunately, this virus is changing. And it's changing to become more contagious and more serious when someone gets it. And so what we've seen in just the last week is that our trends have either plateaued, so they're not going down anymore, or they've even eked up a little bit. And I think it reminds us all that we need to remember to stay vigilant. It's why we say we have to keep wearing masks, why we race to vaccinate as many people as possible. So again, want to remind everyone that if you are over 16, you are eligible to get the vaccine. We want you to get it as fast as possible. And as you mentioned, in Dare County, it was a slight uptick in cases here, so we still do have to be concerned about wearing masks and being socially distant. Follow those 3 W's while we get everyone vaccinated. Thank you. No, Sheila, if you want to.
Yeah. And Sam, just to add to that, I have been talking to our team and our healthcare providers. We were somewhat expecting a little bit of an uptick, especially in light of spring break was last week. People are coming back now with all of their travels, and we have symptomatic folks in the community. So as the governor said, the virus is still here. There's still a lot of virus in the community. So we really, really need to, even though we're doing great with the numbers of getting vaccinated, we can't let up. We need to get everyone vaccinated in Dare County to protect ourselves and protect others. Thank you.
Thanks, everyone.
Thanks, everybody. Thank you for your service.
Governor, thank you so much.